Okay, good afternoon, students. Okay, today we are going to discuss about the sagittal section of the head and neck. Okay, why you supposed to know about the sagittal section? What are the structures which are present in the to take the sagittal section, especially the mid sagittal section? Mid sagittal section, if you take, what are the structures we are going to see from anterior to posterior? All these things we are going to discuss today. Okay, why you supposed to study? We are supposed to know what are the structures which are present in the midline. Suppose if you take this one, this is the X-ray head and neck. Routinely, we are taking in our clinical practice to detect or to diagnose the different clinical conditions. Here you see this is the head and this is the face and this is the neck. Okay, here with the help of this X-ray, we can find the defects in the cervical vertebrae. That is, these are all the cervical vertebrae, and this is the mandible, and this is the maxilla, and this is the maxillary sinus, and this is the cranium, and these are the sphenoidal sinuses. Okay, and here the alignment of the vertebrae. The alignment of the vertebrae in the cervical region is also you can study. Okay, and here you see the bodies are aligned in the line. And this is also another alignment, and this is also another alignment. These must be present. If there is any disturbance in these lines, you can diagnose if there is a problem with the cervical part, this cervical vertebrae. Okay. Next, you can also diagnose if there is any fractures in the maxilla or mandible and the skull fractures. All these things you can detect with the help of this X-rays. And here also you can see here this is the larynx. Okay, and up to here this is the larynx. After that this is the trachea. Okay, and all these things you can study with the help of the X-rays. Or if you take the CT scan, the CT scan is also you are taking different levels sections, the sagittal sections at different levels. With the help of the sagittal section, you can see here this is the mandible. And these are the teeth. This is the maxilla, and this is the nasal cavity. This is the antrum. This is the vestibule, antrum, and nasal cavity proper. And this is the part. It is a nasopharynx. And this is the laryngopharynx. And this is the oropharynx. And this is the laryngopharynx. Like that. And here you see, you take this is the brain. And at this level, here you can see this is the white matter, that is the corpus callosum, and this dark one is nothing but the lateral ventricle, and this is that is tentorium cerebelli. Okay, this is the cerebellum, and this is the midbrain, and this is the pons, this is the medulla oblongata, and it continues as the spinal cord, and this is the vertebral column, especially the cervical part of the vertebral column. And these are the vertebral spines. Okay, all these things we're supposed to study with the help of the imaging. Okay, that is here you see this is the MRI scan, and here if you want to study, first you're supposed to know about what are the structures which are present in the sagittal plane. To take cut of the sagittal plane from anterior to posterior, what are the structures which are present in the sagittal plane? These things you must know. Then only you are able to detect any abnormality. First you are supposed to know about the normality, then only you are able to detect the abnormality, if there is any fracture or any displacement or any growths. All these things you can study if you have knowledge about the norma. That is what are the structures which are present in the normal section of the head and neck, especially the sagittal section. For that purpose, we are going to study what are the structures which are present in the sagittal section. Okay, next. Here you see this is the section of the specimen, that is the mid sagittal section of the head and neck. Okay, you see this is the nose, and this is the nasal septum. Okay, or medial wall of the nose. Okay, nasal septum, and this is the nasal cavity proper. Okay, and below this is the hard palate, and this is the soft palate, and this is the maxilla, and these are the upper teeth. This is the lower teeth, and this is the mandible. Okay, and in front of the maxilla and mandible, this is the upper lip, this is the lower lip, In between these two, there is a space. This space is called vestibule of the mouth. Vestibule of the mouth is very, very important because we are putting some hard substances into the vestibule of the mouth. And here at the same time, at the upper second molar tooth, just opposite to the upper second molar tooth, there is a opening of the parotid gland. Parotid gland, that is the mostly serous gland. Serous gland, and it drains the vestibule of the mouth. And you see here, after I'm causing the teeth, then this is the oral cavity proper. Oral cavity proper. This is the oral cavity proper. And what you are seeing, this is the tongue. This is nothing but the tongue. Here the tongue, this is the mandible, and here in the posterior surface of the mandible there are two bony elevations. They are called genial tubercles. Genial tubercles. From the upper part of that is the upper genial tubercle, there is one muscle that is called, already, that is genioglossus. Genioglossus muscle. And lower tubercle, there is another muscle, that is the geniohyoid. Geniohyoid goes to the hyoid bone. It goes to the hyoid bone. Okay. And then you see this is the nasal cavity. Okay. Here this is nasal septum. Nasal septum, that is the midline. We are taking the mid-sagittal section. That is why this is the nasal septum. Nasal septum, and after that this is the nasal cavity proper. Here you can see this is the inferior concha, this is the middle concha, and superior concha. Okay, and after that it is the nasal cavity, it opens into the nasopharynx. This area is called nasopharynx. Just posterior to the nasal cavity, there is a space that is called nasopharynx. That is the uppermost part of the pharynx. Already you know, the pharynx, it is divided into three parts. That is the nasopharynx, just posterior to the nasal cavity, and oropharynx, just posterior to the oral cavity, and below that there is another pharynx, that is the laryngopharynx. Laryngopharynx. Here, the upper part, that is the nasopharynx, it is communicated with the nasal cavity through the opening. That is, they are called posterior nares. Posterior, these are the anterior nares. That is the anterior opening of the nose is called anterior nares, and the posterior part of the nose, it opens into the nasopharynx with the help of the posterior nares. And they are also called conae. And here, this is the nasopharynx. Next is this is the oropharynx, and this is the laryngopharynx. Here, the nasopharynx, it is at the level of the C1, above the at the level of the C1, and it is also bounded by base of the skull. And if you take the oropharynx, it lies at the level of the C2 and C3. That is the second and third cervical vertebral level. There is a space. This is called oropharynx. Pharynx, already you know, that is it is a muscular tube. It is a fibromuscular tube, and it is helpful for the passage of food. Okay. Here you see, this part. It is just behind the oral cavity. That is at the level of the C2 and C3. That is the second and third cervical vertebral level. That is that part is the oropharynx. And just below that, there is another part. This is the epiglottis. What you are seeing, this is the epiglottis, and just below the upper border of the epiglottis, up to the lower border of the sixth cervical vertebra, or lower border of the cricoid cartilage. Lower border of the cricoid cartilage, and this part of the pharynx we call it as laryngopharynx. Okay, like that. That is it. Laryngopharynx, it extends from the C4, C5, C6, C4 to C6. Okay, this is the extension of the laryngopharynx. Okay, these are all the things we are seeing in the pharynx. Okay, next, after that, you see here, these are all the bodies of the vertebral column. That is especially cervical vertebrae, and this is the anterior arch of the atlas. Anterior arch of the atlas, and this is the next one is the axis, axis bone, and this is the third, fourth, fifth, and sixth cervical vertebrae. Up to this level, this is the pharynx. Okay, this is the pharynx, and here up to this level, this is the larynx. This cavity is called larynx, and this is the laryngeal inlet, and these are the vocal folds. This is the vocal fold. This is the vestibular fold, and this is the vocal fold. This is the vestibular fold. This is the vocal fold. In between these two, vestibular fold and vocal fold, there is a space. There is a space that is called, that is the cavity of the larynx. Okay, cavity of the larynx, that is the proper larynx proper. In between these two are, this is also called ventricle. Okay. Next, posterior to the vertebral bodies, you can see this is the vertebral column. There is a canal, vertebral canal. This vertebral canal, it provides accommodation to the spine, spinal cord. Provides upper part, it provides accommodation to the lower part of the medulla oblongata, and lower part it provides accommodation to the spinal cord. Okay, this is the spinal cord. Just posterior to the spinal cord, you can see, we observe these are all the spinous processes and vertebral arches of the vertebra, and this is the body of the vertebra. This is the vertebral. These are the vertebral arches. Okay, these are all the things we are seeing in the mid-sagittal section. Okay, you see, this is the nothing but the here. This is nothing but the foramina magnum. Foramina magnum. Through the foramina magnum, the mandible, that is a medulla oblongata. Medulla oblongata it passes, then it continues as the, that is our spinal cord. Okay, this is the pons, this is the midbrain, and this is the medulla oblongata. Okay, this is the foramina magnum. Foramina magnum, and here you can see this is nothing but the cerebellum, and over the cerebellum, this fold of dura is called tentorium cerebelli. Tentorium cerebelli. Above, it attach it to this tentorium cerebelli. This one is nothing but this white colored one is nothing but the falx cerebri. Okay, up to here. This is like, it lies like this. Okay, up to here. This is the falx cerebri. Okay, and in front of this attachment of this falx cerebri, here this is this part of the cranium bones, you call it as crista galli. Just in front of this, you can find a space. This is nothing but the frontal air sinus. And here, this is the body of the sphenoid bone. And within the body of the sphenoid bone, again there is another space. Okay, this is nothing but the sphenoidal air sinus. Okay, sphenoidal air sinus. Okay, these are the sphenoidal air sinuses. Okay, next here, another one important thing, this is the tongue. The tongue is divided into two parts, that is anterior 2/3 up to this level and posterior 1/3. This is the posterior 1/3, this is the anterior 2/3. Okay, in the posterior 1/3, again, over the posterior 1/3 of the tongue, there is a aggregation of lymphoid aggregation, that is lymphoid tissue, that is nothing but the lingual tonsil. Okay, this is the area for the lingual tonsil. Okay, and above that there is another tonsil, that is on both sides of the neck. There is another tonsil at this level. There is another tonsil, that is nothing but the palatine tonsil, and above this there is another tonsil, that is the, at this area there is a opening of the auditory tube. Surrounding this there is another, we see in the next picture, we see what is auditory tube, all these things. Okay, here also there is aggregation of lymphoid tissue, that is nothing but the tubal tonsil, and above that there is another tonsil, that is the pharyngeal tonsil, nasopharyngeal tonsil. Like that, these are the 4 tonsils. They are arranged like a ring. That is why it is called Valdes ring. Okay, and here next you see, these are the different structures we are seeing. If you take the sagittal section, you see this is the vestibule of the nose. Okay, this is the antrum, and this is the nasal cavity proper. And within the nasal cavity proper, it is divided into selves with the help of the self-like bony projections. This is the inferior concha, this is middle concha, and this is the superior concha. And over below this concha, there are spaces. This is the middle meatus, inferior meatus, middle meatus, and superior meatus. Like that, there are spaces. Okay, and these spaces, why there are concha and spaces? That is to increase the surface area of the nasal cavity for air conditioning, for proper air conditioning. That is the purpose of this concha. And if you remove this concha, below this there are spaces. They are called meatuses. And you see here, this is the pharyngeal tonsil, and this is the tubal tonsil. This is the opening of the auditory tube, or this is the pharyngeal opening of the auditory tube, or it is also called Eustachian tube. What is the purpose of this Eustachian tube or auditory tube is here the middle ear is connected to the nasopharynx. With the help of this auditory tube, you can maintain the pressure. You can, according to the atmospheric pressure changes, there is a movement of this air from the nasopharynx into the auditory middle ear, and from middle ear to the nasopharynx. Then it is able to maintain the pressure within the middle ear. This pressure maintenance in the middle ear is very, very important, because if you go to the higher altitudes, suddenly if you go to the higher altitudes, you may feel some buzzing feeling in the ears. That is due to pressure changes. That is variation in the pressure change. If you go to the higher altitudes, the pressure, atmospheric pressure reduces. Because of this reason, there is changes in the movement of the, that is tube, tympanic tube. Okay, that is why that is the usefulness of this auditory tube or Eustachian tube. Okay, and surrounding this tube there is a elevation. This is the tubal elevation, and it is aggregated. There is a aggregation of lymphoid tissue. That is nothing but the tubal tonsil. This is the location for the tubal tonsil. Okay, from this elevation there are two folds. There are two folds. One is going to the towards the palate, soft palate. That is the salpingo palatine fold and salpingo pharyngeal fold. Salpingo pharyngeal fold and salpingo palatine fold. These are the two folds. Here there is a muscle, that is a salpingo pharyngeus muscle deep to this one, and here also there is another muscle, that is levator palatine muscle. Okay, this is the Eustachian tube. What is the location of the Eustachian tube is also clinically it is very, very important, because here whenever there is a retraction of this tympanic membrane. If you want to blow the air into the middle ear, you have to identify the location of the auditory tube or opening of the auditory tube. That is just 1.25 centimeters posterior to the posterior border of the inferior concha. From here to here, that is 1.25 centimeters. That is the distance between the posterior extremity of the inferior concha and the opening of the auditory tube. That is the location for the auditory tube. Surrounding this, there is a tubal tonsil. Okay. Next, coming to here, this is the hard palate, and this is the soft palate. And above the soft palate, this is the nasal cavity. Below the palate, this is the oral cavity. Okay. And here from the soft palate also there are two folds. That is, one is going towards the tongue, posterior 1/3 of the tongue. That is called palatoglossal fold, and another fold it goes to the pharynx. That is the palatopharyngeal fold. Okay. In between the palatoglossal fold and palatopharyngeal fold, here there is a space, triangular space. It is occupied by another lymphoid tissue. That is aggregation of lymphoid tissue. That is nothing but the palatine tonsil. Palatine tonsil. You see here. Okay, you see here. This is the palatoglossal fold, and this is the palatopharyngeal fold. In between these two folds, this is the triangular space, and this is nothing but the palatine tonsil. That is the location for the palatine tonsil. That is here, and this palatoglossal fold, it also forms the boundary between the oral cavity and the pharynx. That is called, this is the oropharyngeal isthmus. Oropharyngeal isthmus. Isthmus means junction. Okay, that is the meeting point, and it is bounded laterally by the palatoglossal fold and below by the posterior 1/3 of the tongue. Okay, and above by the soft palate. Above by the soft. This is the nothing but the soft palate, and this is up to here. This is the hard palate. This hard palate, it is formed by, that is two bones, that is the maxilla bone and palatine bone. Okay, this is the soft palate. This is soft palate. It contains 5 muscles. I think already you know. Madam explained very well about the soft palate. What are the muscles, nerves which are supplying to the soft palate? Okay, this is the end of the soft palate. You call it as uvula. Call it as uvula. If you open your mouth, what you are finding, that is in the posterior part of the oral cavity, there is a one muscular projection. Okay, that is nothing but the mucous-lined projection, that is nothing but the uvula. This is the uvula, and this is the posterior one-third of the tongue. Here in the posterior one-third of the tongue also, here also there are so many lymphoid aggregations. That is why it is called lingual tonsil. Lingual tonsil. Okay. How many tonsils total? 4. This is the lingual tonsil. This is the palatine tonsil, and this is the tubal tonsil. And above that, here this is the pharyngeal tonsil. Pharyngeal tonsil. Pharyngeal tonsil, tubal tonsil, palatine tonsil, and lingual tonsil on both sides. This side 4 tonsils, this side 4 tonsils. All together they are arranged like a ring. That is why you call it as Valle's ring. This is the watchdog. This is it protects both the airways from the foreign material or infectious agents. That is from the oral nasal cavity, there are 2 tonsils. That is, one is the pharyngeal tonsil or nasopharyngeal tonsil and tubal tonsils. They protect they catch any infecting material. And here also there are 2 tonsils. That is the palatine tonsil and lingual tonsils. They protect the oral cavity. Any infecting agents which is entering into from oral cavity into the pharynx, it protects. Okay, that is why there are 4 lymphoid aggregations. That is pharyngeal tonsil or nasopharyngeal tonsil, tubal tonsil, and palatine tonsil and lingual tonsil. These are all the tonsils which are present in the posterior part of the nasal cavity and posterior part of the oral cavity. Okay, these are the structures. And here this is the soft palate, and what you are seeing, this is nothing but the nasal septum. Nasal septum. Okay, then you see. Okay, after that you come to this is the oral cavity and this is the tongue. Okay, you see the specimen. Okay, here this is the nasal septum. Nasal septum. If you take that exactly in the midline, section exactly in the sagittal section, exactly in the midline, this is the nasal septum. Already you know the nasal septum, it is formed by bones and cartilage. That is the osteocartilaginous. Osteocartilaginous. The posterior part it is formed by bones, and anterior part it is formed by cartilages. Anterior part is formed by cartilages, and posterior part is formed by bones. What are the bones? Mostly 2 important bones. That is, one is the perpendicular plate of the ethmoid bone and vomer. Perpendicular plate of the ethmoid and vomer. These are the 2 bones. So they are taking most part of the bony part of the nasal septum. It is formed by these 2 parts. That is, one is the perpendicular plate of the ethmoid bone and vomer. Apart from this, there are a crest. That is the maxillary crest, crest of this sphenoid bone, and crest of the frontal bone. Okay, these are also taking some part, very little part, but mostly the bony part of the nasal septum. It is formed by perpendicular plate of the ethmoid bone and vomer. These are the 2 most important bones. Then anterior part, this part of the bone is cartilaginous. The nasal septum is cartilaginous. It is formed by median nasal cartilage, and some part by the lateral nasal cartilages, and anterior most part of the nose, it is formed by fibrofatty tissue. That is why it is lined by, it is having a hair, that is it is provided with hair. They are called vibrissae, that is stiff hair. They protect the entry of foreign material or dust particles into the nasal cavity. Okay, and here what is the importance about the nasal septum is most of the occasions it is deviated to one side, right? Mostly to the right side, and the antero-inferior part of the nasal septum. Antero-inferior part of the nasal septum. At this area, there is a anastomosis of the arteries. That is nothing but that is a sphenoidal artery, posterior sphenoidal, and ethmoidal artery, and the septal branch of the facial artery. All these 3 arteries, they are anastomosed here. This area is called little area or Kesselbach's area. Okay, little area, and this is the most commonly area prone for the bleeding to the nose. That is epistaxis. Epistaxis or bleeding from the nose is nothing but the that is any ulcer or any damage. There, this area it produces profuse bleeding. Okay, this is the area. Okay, next you see here clearly, this is nothing but the sphenoidal sinus. Sphenoidal sinus, very big sinus. And here above this, this is the fossa for pituitary gland. Fossa for pituitary gland, and this is the pituitary gland. This is the fossa for pituitary gland. Hypophyseal fossa. Hypophyseal fossa. And here, this is the sphenoidal sinus. It also opens into the nasal cavity. Okay, here you see this is the posterior extremity of the nose, nasal cavity, and it is opening into the nasopharynx. This is nothing but the nasopharynx. Here, this is the pharyngeal tonsil, nasopharyngeal tonsil. If there is any growth, overgrowth of this pharyngeal tonsil or nasopharyngeal tonsil, it may produce obstruction to the posterior nails. Posterior nails, that is nothing but the adenoids. That is nothing but the adenoids. Okay, this is the structure. It is responsible for the development of the adenoids. Okay, and below this, this is the soft palate. Okay, this is the soft palate, and here you see this is the tongue, and this is the mandible, and this is the lower teeth. This is the maxilla, upper teeth, and in this space is nothing but the vestibule of the mouth. And this is the oral cavity proper. Oral cavity proper. Okay. Next you see here. This is the I removed some part of the nasal septum. You see here. These are the concha. This is the inferior middle concha. This is the inferior concha. Above that superior concha. Okay. These are all the concha. And then you see here. These are the clearly you can see the concha. This is the inferior concha. This is the middle, and this is superior. Okay, these are the, and below this inferior concha there is a space. This is the inferior meatus. This is the middle meatus, and this is the superior meatus. Sometimes there will be another meatus. That is the supreme concha and supreme meatus. This is the sphenoidal sinuses. Okay, this is the, and here you see this is the frontal sinus. Frontal sinus. Okay, and this is the soft palate. Okay, this is the foramina magnum. Foramina magnum, and here you can see this is the vallecula. This part is called vallecula. That is the just anterior to the epiglottis. There is a space, a depression on both sides of the this epiglottis. In the there is a midline. There is a glossoepiglottic fold on both sides of this glossoepiglottic fold. This is the vallecula. This part is called vallecula. Then this is the laryngeal inlet. Laryngeal inlet. This is the laryngeal inlet. Okay, this is the laryngeal inlet. Next, you see if you remove the concha, then you can see the openings of the different sinuses. And here, this is the inferior nasal concha. After removing this one, this is the opening of the nasolacrimal duct. Nasolacrimal duct. It opens into the inferior concha. This is the opening of the nasolacrimal duct. That is, if there is any overflow from the nose, there is ice, that is due to excessive secretion of the tears. They are drained into the inferior nasal concha through the inferior meatus through the nasolacrimal duct. Nasolacrimal duct. Okay. If you reflect the middle meatus, middle concha, then you are able to see that this is the middle meatus. Middle meatus. If you reflect this middle meatus further, you see here, this one is the hiatus semilunaris. Hiatus semilunaris. Hiatus semilunaris. And this above this hiatus semilunaris, this elevated area you call it as bulla ethmoidalis. Bulla ethmoidalis. This is the bulla ethmoidalis. And here this is the frontal sinus. It opens into the this hiatus semilunaris. And here this is the sometimes these frontal sinus and anterior ethmoidal sinus, they may open into the separately into the middle meatus, but most of the occasions they open into the hiatus semilunaris. And from the posterior part, there is another opening here. This is the opening of the maxillary sinus. Maxillary sinus. The maxillary sinus is also called antrum of Highmore. Antrum of Highmore. Antrum of Highmore. Why? Because it is the largest paranasal sinus. Paranasal sinus. Here, the problem with this hiatus similonaris is from here, the frontal eye sinus and ethmoidal sinus opens, and middle ethmoidal sinus also. And the posterior part of the hiatus similonaris, there is opening of the maxillary sinus. Because if there is an infection in the frontal sinus, the infection may directly go through the gravity into the maxillary sinus. The infection may settle in the maxillary sinus. And this is the also dependent part. Because of this reason, most of the occasions, if the person is suffering with the frontal eye sinusitis, and automatically they also develop the maxillary sinusitis. Maxillary sinusitis. Okay, this is the hiatus similonaris. Into this, that is frontal eye sinus, anterior ethmoidal sinus, middle ethmoidal sinus, and maxillary eye sinus. Maxillary eye sinus. All these sinuses, they open into the middle meatus. Middle meatus. This is very, very important. Okay, this is the hiatus similonaris, and this part is called bulla ethmoidalis. Bulla. Bulla means any elevation. Mucous elevation, we call it as bulla. And this is the bulla ethmoidalis. Okay, above this, this is the superior meatus. Superior meatus. This is the superior meatus. And into this, there is opening of the posterior ethmoidal sinuses. And just posterior to this superior meatus and middle meatus, there is a space. There is a space. This is called sphenoethmoidal recess. Sphenoethmoidal recess. And to this sphenoethmoidal recess, the sphenoidal air sinuses, they drain. The sphenoidal air sinuses, they drain into the sphenoethmoidal recess. Here, the sphenoidal air sinuses infection, it is very rare. But if there is any inflammation or any infection into the sphenoidal air sinuses, it produces severe headache, dull aching pain at the base of the skull. Base of the skull. Unexplained pain. Unexplained pain. Whenever you bend like this, then there is a drainage of while doing yoga, different positions of yoga. That is why you are advising yoga to the patients, because in different positions of the yoga, all these paranasal air sinuses, they drain from the, because if you see, the frontal sinus is here, the maxillary sinus is below, and sphenoidal sinus is here, and ethmoidal sinus is here. Okay, in different positions of the head, there is a drainage of these sinuses, and it facilitates the any infection, it may drain out. Okay, that is the another advantage with the yoga. Different positions of the yoga. Okay, next you see, this is the opening of the Dissection tube. Dissection tube, and here you see, this is the tubal elevation. Tubal elevation, and this is also called tubal tonsil. Tubal tonsil. From this is the salpingopharyngeal fold, and this is the salpingopalatine fold. Palatine fold. Here there is one muscle. Here also there is another muscle. They are connecting with the tube with the pharynx, tube with the soft palate. Okay, in between these two, this is the posterior concha, and 1.25 centimeters posterior to the posterior extremity of the inferior concha. There is a opening. This is the opening of the auditory tube. Auditory tube. Okay, and just posterior to this one, this is the fossa of Rosenmuller. Fossa of Rosenmuller. Here, this is fossa of Rosenmuller. This one is the fossa of Rosenmuller. And this is the pharyngeal recess. This is also called pharyngeal recess or fossa of Rosenmuller. Okay, this is the fossa of Rosenmuller. Okay, next coming to this is the soft palate, and this part is the hard palate. Up to here, this is the hard palate. It is formed by two bones. That is, one is the maxilla and palatine. Maxilla and palatine bones that take part in the formation of the hard palate. And this is the soft palate. It is made up of fibromuscular tissue. Fibromuscular tissue. There are 5 muscles. Already you know the muscles. That is a uvula and pharyngeal, palatoglossus, palatopharyngeus, salpingopharyngeus. These are all the muscles. Okay, that are attached with the soft palate. Okay. Next here, this is the tongue. Okay, and here you see from the tongue, this is the genioglossus muscle. Genioglossus muscle. And here, this is the another muscle, geniohyoid muscle. It goes down. Geniohyoid muscle. And here, this is the epiglottis. This one is the epiglottis, and here this is the inlet of the larynx. Inlet of the larynx. Here you can see clearly. This is the epiglottis. Okay, this is the vallecula. This is nothing but the vallecula. And again, on both sides of this larynx, there is another space, the depression, that is called piriform fossa. Piriform fossa. On both sides of this larynx, there are two depressions. They are called piriform fossa. Piriform fossa. This piriform fossa, it is the most common site for the obstruction to the foreign particles. Foreign, if accidentally, if you swallow any, our children or adults, if they swallow any foreign particles, that is peanuts or some coins like that, they may obstructed in the, there is a piriform fossa. Piriform fossa on both sides of the larynx. Okay, and previously some smugglers, they are also used to this one as a secret place to hide the valuable diamonds. Valuable diamonds. They may put in the piriform fossa and they just stitch. After reaching the this target area, again they open and they take out this valuable diamonds. That is also one of the way to smuggle the valuable diamonds. Okay, that is the importance of the piriform fossa. Here you see, this is the one fold, this is another fold. In between these two folds, this is the palatine tonsil. Okay, this is the palatopharyngeal, this is the palatoclassic. And again, in the lower limit of this soft palate and posterior border of this pharynx, there is another junctional point. This is called isthmus of the pharynx. Isthmus of the pharynx. Okay, between the nasopharynx and oropharynx. Here also there is a oropharyngeal isthmus. Oropharyngeal isthmus. This is also another isthmus. Here, this isthmus, it protects the airways from the upward movement of the food material. Upward movement of the, usually if you take any food or liquid, it goes down. But with the help of the soft palate and the pharynx and this isthmus, if there is any defect with the soft palate, because of paralysis and in old patients, they may suffer from brain stroke, heart stroke, and brain stroke. There is a chances for the paralysis of the muscles which are present in the soft palate, and they may produce, they become incompetent. And in that occasion, the fluid, the liquid, what taken by the patient, or any solid material, they may go in the reverse direction. They come out to the nasal cavity. Okay, or sometimes it may go into the larynx. This is the laryngeal. Here you see, this is the epiglottis, and here this is the epiglottic fold. Epiglottic fold. This fold is nothing but on both sides of the larynx. There are two folds. There is this is the arytenoid cartilage, and this is the epiglottis. In between these two, this is a epiglottic fold. This side also there is another epiglottic fold. In between these two folds, this is nothing but the laryngeal inlet. Laryngeal inlet. Here, whenever you are taking some food or any liquid, this epiglottic fold contracts. Here, there is a muscle, that is the epiglotticus muscle. It contracts, and this part comes to approximately with this. There is a tubercle of the epiglottis. Then it closes. Then it provides a passage for the material or any liquid through the pharynx. This is the watchdog, or protecting this larynx from the entry of any foreign material. Okay, here that is the laryngeal inlet. This part is the laryngeal inlet. Next, you see, this is the one specimen, classical. That is the midline sagittal section. These are the sinuses. This is the nasal cavity. Okay, this is the oral cavity. And here you see, this is the laryngeal inlet. Here, these are the two folds. This is the vestibular fold. This is the vocal fold. Vestibular fold and vocal fold. Here, this vestibular folds and vocal folds are very, very important, because if you want to put any tube artificially, if you want to give any respiration to the during elective surgeries or during any emergencies, if there is a respiratory failure, if you want to put the tube, first you have to visualize the epiglottis with the help of the laryngoscope. You have to lift the this epiglottis towards the tongue. Then you are able to see the laryngeal inlet. Then you have to find out these vocal folds. You have to pass the tube in between the vocal folds. That is why this epiglottis identification in laryngeal inlet. Otherwise, sometimes the tube may go into the pharynx, and it is creating unnecessary trouble to the patient. The tube must go into the larynx. Okay, that is the one important thing. And another one, if you want to pass another tube, nasogastric tube. Okay, the nasogastric tube means through the this is also called Wright's tube or feeding tube. If you want to introduce the nasogastric tube into the nose first, then it goes like this and it crosses the concave. Then it comes out through the that is posterior nares. Then it enters into the pharynx. Nasopharynx first, then oropharynx, then laryngopharynx. Okay, and at this time you must be very careful. You ask the patient to swallow because it has to provide a passage for the laryngeal tube, that is Wright's tube. Otherwise, it may enter into the larynx. It may produce severe cough. Okay, that is why you must know the anatomy of this sagittal section. If you want to pass the tube, you must know what are the structures we are coming in the way of the passage of the tube. And if you want to pass the ET tube, also same. You have to, if you touch this posterior part of the tongue and soft palate, it may produce vomiting. Because of this reason, usually we give some sedative to the patient while putting the Wright's tube or not Wright's tube, endotracheal tube, ET tube. And here, next coming to this nasal part, it is lined by mucous membrane. Okay, nasal part, it is a nasal cavity total, and the upper part of the soft palate and hard palate. All these are structures, they are lined by the stratified ciliated columnar epithelium. Sorry, pseudostratified ciliated columnar epithelium. Pseudostratified ciliated columnar epithelium. If you take the lower part of the hard palate and lower part of the inferior surface of the soft palate and remaining parts of the oral cavity, they are all lined by, and here these are the structures that are exposing to the wear and tear. Because of this reason, there is one epithelium, that is the stratified squamous epithelium, non-keratinized. Stratified squamous epithelium, non-keratinized, because to maintain the moisture, there is a stratified squamous epithelium, non-keratinized. That is also very, very important. Lower part is lined by stratified squamous epithelium and non-keratinized. Upper part it is lined by pseudostratified ciliated columnar. That is nothing but the epithelium of the respiratory system. Okay, these are all the different epitheliums which are lining the oral cavity and nasal cavity. Okay, next. You see, here this is the epiglottis. Okay, this is the vestibular fold. This is the vocal fold. Vestibular fold and vocal fold. And this is the cavity of the larynx. Cavity of the larynx or ventricle of the larynx. And here, this is another muscle. This is the geniohyoid muscle from genial tubercle. That is inferior genial tubercle to the hyoid bone. This is geniohyoid muscle. And this is mylohyoid muscle. Mylohyoid line to the hyoid bone. This is the mylohyoid. Okay. Next, you see, these are the vertebral column. This is the vertebral column. Here, the vertebral column must be in the alignment. Alignment of the vertebral column of the cervical region is very, very important. You see, it must be in the proper alignment. Otherwise, if there is any fracture or any displacement of these vertebral bodies or vertebral arches, they may cause damage to the spinal cord. That is the most common cause for the damage to the spinal cord. That is a road traffic accidents, or there is any fall on the cervical region. This is highly dangerous because it may cause transection of the spinal cord, and it may produce paralysis in the lower part of the body. That is why we have to see for the alignment of these vertebral bodies and vertebral spines and vertebral bodies. Next, this is the brain. Here you see the mid-sagittal section. You find the brain also. Here, this is the one hemisphere, cerebral hemisphere, and below this is the white matter of the brain. This is the corpus callosum. We call it as corpus callosum. Here, this is the lateral ventricle. This is the lateral ventricle. These two lateral ventricles. This is one side lateral ventricle. This side also there is another lateral ventricle. These two lateral ventricles, they open into the third ventricle through the interventricular foramen. Okay. Next, here you see this part of the brain. You call it as brain stem. Right? Stem. That is this is the midbrain, and this is the pons. This is the medulla oblongata. And posterior to this is the cerebellum. Over this cerebellum, this is the tentorium cerebelli, and this is the falx cerebri. Okay, this is the frontal air sinus. Okay, these are all the different structures you can see in the mid-sagittal section. Just below this, you can find here in this area there is a thalamus. This is the thalamus, and below that there is a hypothalamus. Thalamus and hypothalamus. And there are different structures we see when we are discussing about the brain. Okay, these are all the, here this is the, already you know, this is the posterior cranial fossa, this is the anterior cranial fossa, and this in between the nasal cavity and anterior cranial fossa there is a thin plate of bone. This is nothing but the cribriform plate of ethmoid bone. Why it is called cribriform? That is a porous. That is why it is called cribriform plate. And this is the most common site for the fracture. This is the most common site for the fracture during road traffic accidents. At this area, it may cause damage to the meningeal layers, and it may produce leaking of the CSF. That is called CSF rhinorrhea. Okay. And if you want to examine the nose, nasal cavity, there is one instrument, that is rhinoscope. They put the small funnel-like structure into the nose to examine the status of or any ulcers or any damage to or any growths in the nasal cavity with the help of the rhinoscope. Or if you want to see the larynx, the status of the larynx with the help of the laryngoscope. We pass the laryngoscope through this oral cavity. Then we lift the epiglottis. Then you can see the larynx, status of the larynx, especially the vocal folds, or during endotracheal tube. This passage of the endotracheal tube also, you use the laryngoscope. Okay, and this is the posterior cranial fossa, and here this is the medulla oblongata, and it continues downwards at the spinal cord. Here, this area also is very, very important. Whenever there is an increase in the intracranial pressure, or intracranial tension, it produces pressure over this lower part of the medulla oblongata, and it may herniate down through this foramen magnum, and it may cause compression over this medulla oblongata, and the person may die. Because of compression over this. It is called coning. Okay, that is the importance of this foramina magnum. This is the location for the foramina magnum. Here, this is the dens, or that is a odontoid process of the second cervical vertebra, and this is the anterior arch of the first atlas, or first cervical vertebra. Okay, this is the posterior arch, this is the anterior arch, and between these two there is a joint, small joint, and here during hanging there is one ligament is there. There is this ligament or this anterior arch, it may dislodge and it may compress the spinal cord. This Varantine process, it may press the spinal cord, medulla and spinal cord, lower part of the medulla. And it is the most common cause for the death of the patient, the person during hanging. That is the importance of this dense and anterior and posterior arches of the atlas. Okay, these are also had to see. Okay, this is the alignment of this in between these two vertebral bodies. There is a intervertebral disc. It's nothing but the intervertebral disc. Okay, this is what you are seeing. These are all the intervertebral discs. They are acting like a cushion. Okay, here you see this is the larynx. The larynx, it continues down as the trachea. This is the trachea. Up to here, this is the larynx. Below this is the trachea. Okay, this is the trachea, and these are all the tracheal rings. What you are seeing, these are all the tracheal rings. They are made up of hyaline cartilage. Hyaline cartilaginous rings. C-shape. They are not to complete ring. They are a C-shape. They are not the complete ring. They are like this. Letter C. Okay. These are all the things you are seeing in the mid-sagittal section of the skull, head and neck. Mid-sagittal section of the head and neck. Okay, this is the soft palate, and this is the opening of the dissection tube. Okay, this is the foramina magnum. This is the mandible and tongue, and this is the genioglossus, geniohyoid. Okay, these are the concave, inferior, middle, and superior concave. This is the sphenoidal air sinus, and here this is the frontal air sinus. Okay, and this is the epiglottis. This is the vallecula, and this is the inlet of the larynx. Okay, you see these are the openings of the paranasal air sinuses into the nasal cavity. That is in the lower part. That is inferior nasal concha, inferior meatus. It receives the nasolacrimal duct from the orbit, and middle concha, it receives that is anterior ethmoidal sinus, middle ethmoidal sinus, frontal sinus, and maxillary sinus. They are all drained into the middle meatus. Here there is another important structure, that is this is the hiatus semilunaris. Or that this is the ethmoidal bulla ethmoidalis, and this is the sphenoidal air sinus. It opens into the posterior part of this space. This is called sphenoethmoidal recess. The sphenoidal air sinuses, they drain into the sphenoethmoidal recess. These are all the paranasal air sinuses. They are draining into the nasal cavity. Okay, here you see this is the opening of the auditory tube or dissection tube, and this is the tubal elevation, and this is the tubal tonsil, and above this is the pharyngeal tonsil, and below this is the lingual tonsil. Here this is the location for the lingual tonsil. You see, this is the lingual tonsil, this is the tubal tonsil, this is the pharyngeal tonsil, and this is the palatine tonsil. So these are all arranged in the form of a ring. Okay, these are the vertebral bodies, and in between these are vertebral discs. This is the larynx, and this is the vallecula. On both sides of this larynx, there are another depressions. They are called piriform fossa. This is the most common. Clinically, it is very, and in your examination point of view also, piriform fossa, it is very, very important short answer, because clinically it is very, very important, because this is the most common site for the obstruction to the foreign material. They are trapped in the piriform fossa. Okay, and here just posterior to this the tubal elevation. Here this is called fossa of Rosenmuller or pharyngeal recess. Or fossa of Rosenmuller. Okay, this is next. This is the nasal septum. Okay, these are all the structures, and this is the posterior 1/3. Here you can see these are the nothing but the circumvallate papillae. That is the junction between the anterior 2/3 and posterior 1/3. Okay, this is the circumvallate papillae. Okay, these are all the. This is the hard palate. It is lined by mucous membrane, That is nothing but the stratified squamous epithelium, non-keratinized. And over this total area, nasal cavity and upper part of the soft palate and hard palate, and some part of the all this area, it is lined by pseudo-stratified ciliated columnar epithelium, except some part, that is some part of tip of the epiglottis, and here that is over the aryepiglottic folds. Aryepiglottic folds, they are lined by stratified squamous epithelium, non-keratinized, because they are exposing to wear and tear. Wear and tear. That is why they are provided with the special epithelium. That is only this part of this larynx, it is lined by stratified squamous epithelium. Remaining part, it is totally, it is lined by pseudo-stratified ciliated columnar. Okay, these are all the things you must study, and whenever there is a chance, we will study the help of the specimen. And along with this, I will send some links related to the videos related to this cross section of the sagittal section of the head and neck, and I send to your representative. Okay, you go through and study. Okay, that is the about the sagittal section of the head and neck. Okay, thank you.